Welcome to this mini webinar about the AnyRidge implant available from Megagen IDS. Over the past 5 years, I've absolutely enjoyed placing this implant. It has shrunk down the treatment time for almost all my cases by a third. And it is simply more efficient and more cost-saving implant that you can ever find. My name is Dr. Isaac Towell. I am a dentist in Brooklyn, New York. I've been placing implants for 13 years. I have a dental degree from NYU University, and I have a master's in biology. What truly separates the AnyRidge implant apart is its thread design. We have various different types of bone qualities, ranging from D1 in the anterior mandible to the softer D4 bone in the posterior maxilla. The AnyRidge implant system is designed so that you would drill the same size, yet place a different size implant depending on the density of the bone. So you see in the image here, the D1 bone would have a smaller implant than in the D4 bone, yet the same size drill was used. You'll see in this video how the AnyRidge will basically shrink down when we place it. You'll see once we drill into this spongeous material and we get our osteotomy site, how we'll be able to save this crestal bone. So we're using just a simple drill, and then we're placing our implant, and the implant, as it submerges, will virtually disappear into the bone. And this is what happens intraorally in the mouth. What we find is when we place the implant, we can preserve that crestal bone, which is so vital and becoming harder and harder to manipulate these days. We have great different grafting techniques, but wouldn't it be nice not to have to graft at all and to just use the bone that you have remaining and save it all by this cutback design of the AnyRidge implant? The surface area is another discussion that we have with many other clinicians. So if you're used to using parallel straight implants like you see in the image on the left-hand side, we see a 5 by 10 millimeter implant, which has a surface area ranging about 208 millimeters squared. When we compare the taper design of the AnyRidge implant, which is 5 by 10 millimeters, we actually have a 30% increase in surface area. And you can see that we have a 308 millimeters squared surface area. So in fact, the AnyRidge implant is actually stronger than its competitive implants that are non-tapered parallel implants, giving us better surface area, which leads to better initial stability. The surface treatment, SLA, sandblasted and acid etched treatment, is becoming more and more pronounced in dental implantology. The reason is that SLA treatment provides better cell proliferation to allow more osteoclastic and osteoblastic activity for our implants to be able to integrate. What sets the AnyRidge apart is that they're not just using regular sand material, they're using a calcium ion material, which allows more phosphates to come later on, which helps that cellular proliferation, giving us the ability to load this implant faster than pretty much any other implant on the market today. The abutments are extremely important. If we lose the amount of tissue that we have, then we will have obviously more problems and showing of more of our abutments and our implants as time goes by. The AnyRidge was designed with an S-line curve to give us the ideal emergence profile, mimicking natural teeth. It allows us to place the implant, use an anatomical healing abutment, and then use an anatomical abutment to be able to mimic natural dentition. Loading implants is becoming a hot topic in implant dentistry, and Ostel, which was developed about 10 years ago, is becoming the standard as to whether we should be loading our implants immediately or if we should hold off and load our implants later on. So the Mega ISQ, created by Ostel, can accurately measure it. What's nice about this ISQ reading is that it does have readings on the probe, so we don't have to constantly refer back to the base unit to see whether or not we have our readings. We can actually see it on the wand itself. ISQ is vital into immediate loading and if we're wondering whether we should do early loading. The AnyRidge implant, when we use the Ostel, will have a consistent ostial reading from the moment it's placed, and it'll simply just increase over time. As opposed to other implants that I've placed, we see a drop, usually about the 4th week. As implants integrate, during that 4th to 6th week, there is a decline in ostial readings because we lose bone implant contact as cellular activity is going on around the implant, and then it slowly increases by the 6th week. With the AnyRidge, we don't have that, which enables us to be able to keep immediate loads and not have to worry about the implant failing us. The 5-degree taper of the AnyRidge virtually eliminated screw loosening in my practice. I haven't had a screw loosenings in the last 5 years since I placed the implant. As a matter of fact, in some cases, we actually remove the screw just to test it to see what will happen if the abutment will fall out. While I don't recommend doing that in your office, I'm confident that I can tell you now that there are no abutments falling off in my practice today. The pull-out force for the AnyRidge is actually extremely high, and by use of an abutment remover is the only way to be able to take the abutment out of the implant. That's how strong that connection is. All the pieces to the puzzle are coming together, and digital dentistry is transforming the way we practice. CAD/CAM dentistry and design is becoming the optimal way to be able to restore our teeth. And we can now by use of scan abutments, we can use them through all the different digital medias to be able to replicate our dentition, create zirconia abutments, TiGen abutments, and be able to create a CAD/CAM crown as well. So whether you're going digital, conventional, or you like multi-unit abutments, we have all the different prosthetic connections for you to be able to do it. Whether you want to scan and then create a in-office abutment and crown, or you like to take the open tray, closed tray impression and have the lab fabricate it, or whether you want to use multi-unit abutments for all-on-X procedures, we can use open and closed trays impressions over that as well to be able to give our patients their final prosthetic design, and these are all easily retrievable and easily placeable into our dental implants. All for one and one for all, the AnyRidge has one prosthetic connection for 10 different diameters. That greatly reduces the stock and storage needed for our implants. There's no more questioning what abutment goes to what implant or what impression transfer we should use on what implant. You can pretty much go to any implant size, take the necessary healing abutment or transfer, and place it in the mouth and take your impression or load your implant. The AnyRidge implant has greatly reduced patient recovery time and improved the way I practice implant dentistry. The system is easy to use, and its unique features deliver the best aesthetic outcomes every time. For more information, including tremendous cost-saving offer, contact IDS at the phone number on the slide. Thank you for your attention and for your time.